Greetings, Dr. Mark Winton here from the University of Central Florida, Department of Criminal Justice, and I'd like to briefly present a study that was conducted in 1998 by Neil Jacobson and John Gottman, and they published their study in a book that is titled When Men Batter Women: Insights into Ending Abusive Relationships, and it's published by Simon & Schuster. I actually have the book, which I read a long time ago, and I really liked it, and I kept it, and I presented it over the years. And of course, what I think is relevant here is, you think about 1998 was a long time ago, and now we can begin to think about, well, okay, this is where we were in 1998. Well, where are we now? What has changed? What have we learned since? What are we doing in regards to this social problem? So I'm going to briefly go over some of their results. I must say I've made a few videos earlier today, and it just seemed that I need to be brief and concise in presenting the results rather than getting into discussions of the political debates at that time and the political debates now that are going on in regards to this topic. So I'm going to leave that out. They recruited 201 participants through public service announcements and media outlets, and they used interviews, videos, and also physiological measurements to collect their data, and they were able to break down the groups into levels of violence. What they basically found were two groups that they labeled cobras and pit bulls, and I'll go into more detail in just a few minutes on that. But I would also want to mention one of the major findings of importance was that the violence, battering rarely stopped on its own without some type of intervention, whether that be therapy, criminal justice intervention, or a combination of those. The violence rarely stopped on its own, and it wasn't even clear at that time whether or not interventions stopped the violence. In the beginning of their book, they present a lot of the myths that we had at that particular time regarding domestic violence or interpersonal violence, intimate partner violence, or in this case, when men batter women. And just to mention a few things, it's a myth that all batters are alike. We know that there are some differences in clearly among batterers, and that's important to note in regards to our interventions, because we want to match up our interventions to the type of person that would benefit most from that type of intervention. Also, they stated, and it's kind of a controversial statement, but battering is never caused by drugs or alcohol. And they pointed out that there are some that use drugs and alcohol, and that seems to increase the risk of their battering behavior. And so that's important to note in terms of interventions, that someone who is abusing drugs and alcohol will also need a substance abuse treatment program or intervention. I already mentioned that it's a myth that battering often stops on its own. It doesn't tend to do that. Also, they talked about some of the relational aspects, the myths. And the last one I want to mention is that it's a myth that there is one answer to the question, why do men batter women? There are actually multiple answers to that question. So if we look at the cobras tend to be belligerent and defensive and have contempt for women. They also tend to be much more violent and have higher rates of emotionally abusive behavior toward their partners. Also, their partners, their wives, tend to be more depressed and more scared of them when compared to the pit bulls, who we'll look at in a minute. Also, they found that the cobras had a greater amount of childhood violence and chaos in their childhood families. And they also, taking a look at the cobras, found that they did not easily separate or divorce from their partners, and there's always risk in marital dissolution and battering that the batterer will increase the violence or maybe even kill the partner. We've seen that happen before. Also, the cobras tend to be more violent outside of the home as well as inside. So they're committing violent crimes inside the home, but also outside the home as well. So they're fighting, assaulting others, getting in arguments and the like. There also seems to be a higher rate of mental disorders among the cobras, and they're also more likely to be addicted to drugs. In contrast, the pit bulls tend to be demanding but then withdraw, and their partners are less fearful. They also tend to have lower rates of violence outside of their marriage, and even though they have and show contempt for women, they're also dependent on them, which was not the case in terms of dependency with the cobras. The pit bulls also had a physiological arousal when acting out aggressively that was found higher than in the cobras. When they looked at batterers who tended to decrease their violence, they found that they tended to be younger, more satisfied with the relationship, have lower levels of emotionally abusive behavior, and be less belligerent and domineering, and also less physiologically aroused. A good portion of the book also talks about intervention, treatment, or rehabilitation. And one of the things that was pointed out that a huge majority of the battering cases never even entered the criminal justice system. And so that was mentioned. They also talk about different ideas regarding interventions. For example, they mentioned that couples therapy for battering would be inappropriate to use because of the risk of violence. They also mentioned that anger management and social skills may be part of a coordinated community response. I know when I was working in the field, there was actually a written into, I think, the laws that we weren't allowed to do anger management for battering. Now, we could do anger management within a program, but just anger management on its own, I guess, was prohibited. Also, they mentioned the use of medications, and at the time they wrote about the use of certain antidepressants to decrease violent impulses. And there's a lot of debate regarding the use of medication. Now, of course, if you had a batterer who was clinically depressed, an antidepressant would be appropriate to treat the depression. If it decreased aggression, that would be a benefit as well. The big question is, would they use, for example, an antidepressant in a non-depressed batterer in hopes to decrease the violent behavior? And there's a lot of debate around that because the medications aren't addressing power and dominance and gender inequalities. And so a lot of debate about that, and I wonder how much debate continues with that scenario. Also, I think it's relevant to look at what resources are available in the community and how the criminal justice system responds, including police response, but also prosecution of cases, programs, referrals to court-ordered programs, voluntary treatment, funding and prevention, and also the effectiveness of programs. For example, they mention 4 programs they mentioned at least 4 programs. I just jotted those down years ago, and that's anger management, the Duluth model, the Emerge model, and the Amend model. And I would ask you, how are those doing today? What's the status of those particular models? What's being used? What seems to work? What doesn't work? What have we found certain programs are more effective than others? And there's a wealth of literature out there showing that some programs are more effective than others, and that some certain types of batterers benefit from specific types of programs, and so matching that up, we've already briefly touched on when we looked at R&R model, for example. There's still a lot of work to be done, and one of the things, though, I wanted to mention is that, and the relevance here, of course, is that when we look at any type of interpersonal violence, we also want to look at other scenarios that may be occurring in the family. For example, child abuse and neglect, and so certainly we see that there's that relationship with battering and also child abuse and neglect, and so we have to look at really I think a big picture here when we're working in the field. And what I'll do is wrap up this video. Certainly didn't want to get into any, and I won't get into any politics, but what I will mention my observation years ago, and I don't know if this is still occurring today or not, but when I did work in the field, when I was a young, energetic man who thought I could solve a lot of problems with the models that I had at the time, I became quite frustrated because I saw that the system failed. That even if I applied the clinical models that I had learned, that there seemed to be problems. For example, funding ran out for treatment, or the person was court-ordered for a certain number of sessions, but not necessarily the number of sessions that they really needed. Or the person was referred inappropriately to a program, or there was conflict between 2 agencies and the client ended up not getting the services that they and their family needed. So I mean, there are problems in the system as well that we need to analyze and resolve as well. So I think it's important to look at all of this, not only the individual and the family, but also the community and the different systems, the mental health system, the criminal justice system, the support systems that are out there that may be used as well to resolve problems. All right, and this wraps up this video.